CBS 13 News is on your side, live at 5:30.
I've made a decision to die in my home.
Maine is the oldest state in the nation, and experts say more and more people are choosing to spend their later years at home.
That's increasing demand for home health care services, but CBS 13 discovers not all aides are licensed or registered with the state. Marissa Bodner is on your side with the questions you should ask before hiring help. Marissa?
Right now, I'm considered a level 3.
72-year-old Grace Babcock has been getting in-home care for the past decade.
I've made a decision to die in my home.
An aide comes to her Portland apartment for a few hours every day.
She helps me do the laundry. I have assistance with my shopping.
But over the years, Grace has learned that with the help comes some risk.
My aide had access to all my PIN numbers because she did these things for me.
In October of 2012, Grace discovered her bank account had been drained. Jean McQuinn was charged with theft and forgery.
I trusted Jean. I believed in her. I loved her like a daughter. I knew of all her family.
Grace's problems didn't stop there. She says another aide tried to hide drugs in her house, and one stole her wedding dress that she hoped to be buried in.
It's hard for me to trust people, you know, and I'm very careful. I don't let anyone go anywhere in my house. I'm afraid, you know.
You do hear those stories, but I'm going to say those are the exception, not the rule.
Senior care advocate Chris Orestis says there are bad apples, but home care generally has a good track record.
Home care is the most preferred method of long-term care.
According to the Paraprofessional Healthcare Institute, Maine has more than 25,000 direct care workers who provide hands-on care to people who need it long-term. They're overseen by the state's Department of Health and Human Services. According to DHHS, some home caregivers are certified nursing assistants, or CNAs, who have to complete 180 hours of training and register with the state. They assist with the client's care and treatment under the supervision of a registered professional nurse. Others are personal care assistants, also known as unlicensed assistive personnel, or UAPs. They show up to help with daily living, like bathing, laundry, and cooking.
And that is an area of home care where there's less regulation. It's because you don't have the implications of medical licensing.
UAPs have to complete a state-approved 50-hour training program if and only if they work for a personal care agency. But they don't have to register as individuals. Even less regulated are aides hired privately by a consumer. The state doesn't keep track of them. Plus, the state can't investigate complaints or have them removed for abuse, neglect, or misappropriation of property. That responsibility falls to local law enforcement.
So you need to do your homework. You want to protect yourself.
Orestis says whether you're using an agency or hiring on your own, there are questions you need to ask.
Look up the company itself. Are they registered with the state? What's their track record with the Better Business Bureau? Just Google them and see if there are complaints.
Next, he says, ask about drug testing and background checks. Under state law, all agencies are required to look at an applicant's criminal history because certain convictions ban a person from doing direct care work.
The turnover can be high, and quite frankly, that's another thing you want to ask when you're looking at a home care company is what's the turnover? I would say it's not even unfair to ask, what do you pay your people? Are you paying them well? Are you a market competitive company paying good rates?
Grace has a piece of advice too.
They do not need to give access to their PIN numbers. That's a big thing.
She hopes the system will be improved before the baby boomers get to be her age.
People in this service are vulnerable people.
According to DHHS, there is a severe shortage of workers willing to do these kinds of jobs. Many in the industry blame that on low wages and a lack of health insurance. DHHS is currently analyzing main care rates paid to home care agencies to try to draw more people into the field. A bill in the legislature is looking to do the same. In the studio, Marissa Bodner, CBS 13 News.